successful for her, and I'm going to demonstrate what we do. So just like a ultrasound, what we want is we want to use gel, ultrasonic gel, for conduction and better utilization of the sound and effectiveness. Now I have the patient just exposed with the elbow. The unit itself, I'm going to be using what we call the focused headpiece. Basically, if you want to come a little closer, I could show you how this is. As you could see, it's a concave applicator. The difference between this unit compared to other Shockwave units is that this is a piezo effect, meaning it's crystals that line the applicator itself. As the electricity comes in, the crystals, they start vibrating and actually generate a sound pulse. On this particular unit, the piezo wave 2 and the direct applicator that I'm going to be using, the sound pulse is 1 centimeter cube, so like a sugar cube type of a thing. I could change the frequency. There are 4 factors that I could change and modify. I could change the frequency, which I use in her case, a maximum frequency of 8. That gives us 3 to 5 pulses per second. The intensity could be changed, and the highest amount is 18. They're measured with millimeter square per megajoules. By changing these headpieces right here, we could actually change the depth of penetration. We could go as shallow as a 0 millimeter penetration all the way up to 30. And basically the next thing that I could change or modify is the number of pulses. In her case, for the demonstration, we're going to do about 500 pulses to see how the unit works. And basically, we have a foot paddle over here that I could control the pulses, the intensity, and so on. And I'm going to start her at about actually a 5 intensity. We apply the gel to the area, and what we want to have is make sure that we have the head applicator directly on the area that we're treating. I'm going to disperse the gel, and when we're ready, we could go ahead and, by stepping on this or utilizing the button here, we could go ahead and get the sound pulses going on. So what you're going to be hearing is these are the sound pulses, and what we want to do is make sure that we hit all the lateral epi area where the radial head is, the proximal radial head, and we slowly move the applicator around right where the injured area is. And we always want to ask the patient, how intense is it? We always want to make sure that we go to their tolerance and not above that. So how intense is it on a 0 to 10 scale?
Maybe like a 4.
Okay, is that tolerable or should I go down?
No, that's good.
Okay, so we're going to continue with this.
And we'll look at the number of pulses. You could see the total dosage, basically.
Correct. And normally for an extra spinal area like an elbow or shoulder, I do about 3,000 pulses, depending on the patient, how large or small they are. I might modify that for a taller or bigger person that we're covering a larger area. I might be doing actually 4,000 pulses or, somewhere in that area. But we also want to make sure that we hit all the extensor tendons as well as they come into that lateral epi area. And I like to kind of cover a larger area as I go down the back of the forearm to make sure that the belly of the muscles are also affected, because this breaks up the fibrosis and adhesions within the muscle and not just the scar tissue around the joints. Are you still doing okay?
So one of the things about scar tissue is that and adhesions, let's explain that a little bit.
So adhesions and fibrosis, think about the analogy of it as like cobweb that forms within the muscle. Scar tissue, you like to use the analogy of basically rust that forms on a surface or around the joint area. And as we're utilizing this, it kind of like sandblasting a surface. It breaks up all that scar tissue. And
that's a good analogy, sandblasting.
Yeah, and by utilizing sound pulses only, and no electricity, nothing. And as we do that, especially right here, as I'm irritating that periosteum, which is the sheet covering the bone and where the tendon attaches, because we're creating micro traumas, it also causes new blood supply going in there. So as a new blood supply going in, one of the things that the Shockwave does is creates neovascularization, or new blood supply formation, which leads to faster healing process and recovering from the condition.
Right.
That's why it becomes so effective. Now, the other thing that keep in mind again, this is not an ongoing treatment. The number of treatments usually is about 7 to 10 per area, and then we follow up with the patient 2 to 6 months, once a month after the last treatment, to make sure that things are improving and where the patient's at. And if the patient by the second or third month they tell me that they're about 90-95% better, basically they're done. But sometimes they say, well, they plateaued at about 80-85% improvement. In that case, I might decide to do 1, 2, or 3 more additional treatments, basically to get rid of whatever that residuals that are remaining.
Starting to get a bit more intense. Starting to get a bit more intense.
Is that right over here, huh? Do you want me to turn it down? Okay, so let's go down.